Hi, everybody. We're just going to give everyone another minute or so to get logged on. And while we're waiting for everybody to get logged on, I'm going to put the survey link and the replay link and instructions for the certification in the chat. Alrighty, so we're at the top of the hour, so I'll go ahead and get started. So thank you everybody for joining us this evening for our event, championing TIMS MVP for fees, strategies for effective advocacy. This session is eligible for 0.1 ASHA CEUs or 1 PDH. To earn the ASHA CEUs, we just ask that you stay for the entire presentation and complete a brief survey. The survey will be open for 7 days, so it will close next Tuesday for submission. And like I just said, I put the survey link in the chat. I'll also put it in the Q&A, and the survey will also be sent out through the Zoom emails. And finally, if you want the certificate of completion, just send us an email at tims/univ@tims.com. And now I will hand it over to Claire.
Thank you. Thanks everyone for joining me this evening. I'm going to share my screen here. And okay. All right. Does that look full screen, Shannon?
Yes, you're good to go.
Okay. So just a couple objectives for this evening. Number one, identifying strategies to demonstrate return on investment for implementing fees technology within a healthcare facility. Number two, describe effective approaches for securing funding and resources for equipment and training in a clinical setting. And then number three, apply practical advocacy techniques to promote the adoption and optimal use of TIMS MVP for fees in multidisciplinary teams. So just a little bit about myself. This was in the email, so I'm not going to read it word for word, but I do think that this is a unique opportunity for me. This is not something that I normally do, so I'm grateful to be here and spend time with you all this evening. A couple of disclosures. I'm employed by Mercy Medical Center, and I am receiving an honorarium for this presentation. And my opinions are independent of my professional affiliations. Okay. So a little bit of background about myself too is in 2023, of July 2023, the supervisor position in my facility became available, and it was recommended by my predecessor to apply. And so I did. The turnaround was fairly quick, and I found out I got the position, I think it was like a day or two before her last day. And so there really was kind of not a lot of onboarding straight from the horse's mouth. So she was great. She was gracious to give me a very lengthy Word document to kind of help me get started. But honestly, that was about it. From there, one of the very first things that I did was talk to different members of the team. And I wanted to get some ideas individually and as a whole, what they felt like were some areas to improve. And so at that time, it was my opinion that the practice patterns were deeply rooted in the department and a little bit outdated. And so I knew there were some things that I wanted to improve, but I wanted to get some information from the team. So there was a lot of places I could start. I didn't ask point blank, like, hey, what are the problems? I simply, I think I did a survey once. I had them number 1 to 10 areas of confidence. And I really just wanted to know what their strengths were, what they felt like were some areas that they wanted to improve on. And so I was able to identify some patterns within the team and kind of align our department goals with the voices of the team. So In addition, I was able to understand their professional goals. I was able to have those individual conversations and identify professional goals. And, at that time, I felt like that was a good place to start. Like as a leader, I wanted to grow my staff, kind of bring everyone up to this level of equal practice patterns. And so through the last year, it's really become my personal mission to understand some barriers that we have at our organization in our department, and what we can do to mitigate those barriers and provide excellent patient care. So I'm a solution seeker. I always say I'm half and half. My mom and my dad. My dad's an engineer with decades of leadership experience. He's project manager roles, things like that. My mom's an elementary music school teacher, so she's very nurturing and caring and gentle. So I can't help but notice in the last year, as I've reflected on the getting ready for this participation, that I am half and half of each of them. A lot of my qualities are consistent with their characteristics as well. So with that being said, with the team aspect, I was able to identify some gaps in cares and some competencies that we could improve on, and then I was able to understand everyone's professional goals. So one of those goals is that two of the staff members wanted to become endoscopists, and so that was nice because it allowed me to then work when I was identifying some of these problems. That particular goal in and of itself really was a driver for how to improve our department and how to obtain TIMS MVP. So like I said, I'm a problem solver, and with the change in staff at that time, the number one problem that we had is that we only had one full-time fees provider, which was myself, and one PRN fees provider. So as I continued to do more fees, and I was fairly new, I had a year of experience of fees at that time, and I quickly struggled with the workflow that we had at our facility. We had removable media, we had poor access to review. I wasn't unable to view it on like my desktop or even implement it into Epic. There was one example early on. I think I even like texted my predecessor, like, what do I do? But there was one case where I did a fees and the physician wanted, or I wanted to show the physician the picture of the fees image. And so I had to grab my work cell phone, take a picture, and I messaged her and she said, can you just upload it into media? And I really didn't have the ability to do that yet, or we didn't have this software to do that. And so I ran around the hospital trying to find her so I could show her this picture because I couldn't upload it. And so that was just one example of why this was a problem from a workflow perspective and patient care perspective. Third problem is that as I took this role and transitioned into this role, I absorbed the head and neck cancer caseload, which is very new to me. I hadn't had much experience working with that population. So behind the scenes, I was doing a ton of CEUs, trying to gain knowledge and foundation for serving this patient population confidently and comprehensively. So I was also working on that. And with that, I was doing a lot more fees. I was seeing a lot more anatomy that I was not used to. For example, what you see on the screen, this was not, these are the abnormal passes that I hadn't been really exposed to. And so there was just a lot of needs. All of these problems were driving forces for the subsequent actions that took place. So number one, if you are in a similar situation or you're in a situation where you need to advocate for fees technology, whether it be the fees program and scopes and the CART or TIMS MVP, number one, the billing code requires reporting of this study. So that is, without that, you're putting your organization at risk for reimbursement, and you at minimum have that leg to stand on. So I just think that's important for you to recall. But now we're going to dive into demonstrating some return on investment strategies. So What is return on investment? It is a measure that's used to evaluate the efficiency or profitability of an investment. So ROI tries to directly measure the amount of return on a particular investment relative to the investment's cost. So it's thought to be strictly objective. Like if you, I think I remember asking my dad and doing a quick Google search, you'll often see a ratio. However, a lot of different fields apply more subjective outcomes, and so that's what I've done as well. Because as someone who provides person-centered care, that is, I want to talk to what the patients are going to experience, and then as a supervisor, I want to talk to what my staff and workflow is going to experience and how we're going to operate more efficiently. Um, so these are some different strategies that are listed here. These are not like exclusive names that you'd find in a textbook or anything. These are just simply like ways to describe what I did. I'll also preface this by saying, like, I wasn't like, hey, now I'm gonna um, advocate for patient satisfaction and retention. I didn't have these terms going into this project. This is really like a reflection of what I did and how I did it in terms that that I can speak to. So, okay. So I'm gonna there, like I said, there's a lot of different strategies. This is also not all of them. So, oops. So I am only going to speak to the ones in red because those are really aligned with what I did in my department. Um, okay, so these methods are going to help guide you and give you the language that you need to talk around the table with administrators and other stakeholders. I also, in preparing for this talk, I found this really great resource that TIMS has. It's like a flyer. I cut it in half and made it bigger so that you could see. But this is a very simple objective outline for ROI of TIMS MVP. It talks to the, like an example cost of TIMS MVP with the USB cart. It talks about like the license for 4 years, what that would pan out to approximately, and then the monetary gain that they were able to obtain with using a survey data from a survey. So this is just an example flyer that you could use and present at the table. So you should check it out on the TIMS website. Okay. So the first topic that I wanted to talk about was how you can speak to enhancing your diagnosis and treatment plan as a speech pathologist. So better outcomes, right? We know that early and more precise diagnosis leads to more timely interventions, which can significantly improve your patient's outcomes and quality of life. Okay, we know these things. We can also speak to eliminating imaging silos. So having access to the fee studies in like a unified system, such as the EMR, can eliminate redundant testing, accelerate diagnosis, and facilitate more informed decision making. So all of this to say that it can lead to more efficient care delivery and better patient outcomes. When we speak to cost savings, some key points that you can use are avoiding expensive treatment. So we know by detecting swallowing disorders early that fees can reduce the need for expensive treatments, such as prolonged hospital stays, ICU admissions, or any other complications related to aspiration pneumonia. We can speak to fewer rehospitalizations. So patients with better managed swallowing disorders are less likely to require rehospitalization, which is a cost-saving opportunity for your organization. And then another aspects that could be applied to a lot of different settings and patient populations, but by improving our rehabilitation interventions and strategies through the use of fees and fees MVP, it can be more effective and efficient for your department. So using this therapeutic modality for biofeedback, like for example, for a trial tray or an advanced texture, or identifying some different strategies that could be helpful, or even teaching those strategies, this is easily doable with TIMS MVP. So when we talk about operational efficiency, this is language that different stakeholders, you're kind of like speaking their love language. So if I'm talking to my executive director of of rehab or of my department, or even I've had conversations with the director of the cancer clinic. These types of terms are going to help make their ears perk up, right? Like you're going to be talking their talk. And so using terms like operational efficiency or staff efficiency can be helpful to advocate for your ask. So time management, we know that FEES allows for quicker assessments compared to modified barium swallow studies, which have a longer preparation and execution time, results in more patients being seen in the same amount of time. So this increases throughput, or basically like how many people can get through the line, and staff utilization. So it's more optimal staff efficiency. Convenience and accessibility. FEES can be performed at the bedside, which reduces the need for patients to be transferred to radiology or working around the radiology schedule. This improves workflow and patient convenience. At my hospital, for example, it's a conversation that we have to have every time we get a new video order. And so by advocating that FEES can be more convenient for a department, that can help you prove your point. I'm fortunate that my radiology department is very accommodating and willing to squeeze us in around their schedule, but we are also limited to one radiology assistant about a day. So we really have to work around their schedule, and it can be somewhat limiting. Enhanced staff efficiency. So I kind of spoke to this a little bit already, but FEES requires a smaller team of specialized clinicians to perform and interpret, compared to video fluoroscopy, which requires a multidisciplinary team. So for example, at my organization, we've got the patient care tech that's going to help get the patient up and ready for the study. Transport's going to come in and receive the patient and take them down to the fluoro suite. Radiology, the whole radiology team, the radiologist assistant, the radiologist tech, they're all involved. Nursing sometimes is present in our studies. We do NICU video fluoroscopy as well as ICU. And so the nurses are present for that level of care. And then obviously the SLP. So that's a lot more bodies in order to perform that exam versus FEES. Both are extremely valuable. Sometimes both are necessary, but these are just terms that you can use to help describe things that you and I know as speech pathologists to someone like a director of rehab who may not know or understand or have that knowledge. This concept of increased patient throughput and volume, it's really just a numbers conversation, but we know that FEES technology can allow us as healthcare providers to see more patients per day if we have like more speedy and portability procedures. So talking about revenue is, unfortunately, it is what it is. We need funding, or we need dollars or revenue in order for us to provide patient care. And so that's, it is something that we do need to speak to when we're having these conversations. Okay, so the next objective is related to securing funding. And so again, these are just a lot of terms that are available. They're similar to ROI, or return on investment strategies. In my opinion, they kind of go hand in hand. You need to speak to your ROI in order to obtain funding. They're going to want both of that, all that information and a little bit more. So again, I'm going to speak to these 6 concepts that were applicable to me and how I was able to obtain TIMS MVP. And so here we go. So one thing that I think is so amazing, and this is truly a serendipitous encounter, and this happened very early on in my role as a supervisor, but I was doing a FEES and I had a malfunction that I couldn't figure out. I couldn't fix it. So I called the sales rep. Sales rep wasn't the sales rep anymore, but had the same number, oddly enough. And so she directed me to the new sales manager, and he said, "Oh, I'm going to be in the area next week. I'll come out and check it out and see if I can help." It happened to be like a wire that I just needed to replace. It was getting old and not connecting, didn't have a strong connection. And so every time someone sees our fees card, they always comment on how old it is and it's ancient, and it's old, but it still does the job. They even, we at the time we had like a VCR recording system, and they always talk about that. And he gave me his sales pitch, right? Like, oh, did you know, like, you could improve your scope, and we have this deal, and blah blah blah. And I said, yeah, I mean, that all sounds good, but we don't really, at the time, we didn't have the volume to justify this, me purchasing this. And I mean, that really is we're talking about return on investment. At that time, I didn't have the volume in order for me to ask for, X amount of dollars. And so I said, yeah, I great, but in order for me to get the volume, I need more staff to be trained, right? Problem number one is there was only one full-time fees provider. So that all sounds great, but I need more SLPs to be trained in order to do so. And he said, oh, well, you know that Olympus has like a fees training course. And he's like, I think it's like next week. And I was like, what? I hadn't heard of this. I had personally done the Northern Speech one, and it was amazing. But it was several years prior to, and no, I wasn't aware of that. I said, oh, so you just have to like kind of get there and they pay for the course. He goes, no, like they pay for your flight and they pay for your hotel. And I thought, well, that's like kind of sounds like it could solve my problem. I'm asking more questions, and he's giving me all this information. Long story short, I ended up getting myself and two other staff members signed up for this course. We were on a wait list for a little bit, and then it was kind of, I can't remember exactly, but 2 or 3 weeks prior to we got like accepted, I guess. You have to apply, and we got accepted, and it was super exciting. It seemed too good to be true, honestly. And it was my understanding at the time that it was in our contract, like that with Olympus, because we had Olympus equipment. But in preparing for this presentation, I did reach out to Olympus, the contact that I had, and I will quote her: the training is not associated with the purchase of Olympus equipment or capital. So from what I'm understanding, and I encourage you to look into this more if you are wanting to, have this training, is contact them, look into the programs. I think they only do 4 a year, but it is all paid for. Everything's paid for. If you need a flight, they'll pay for it. If you need, a hotel to stay the night, they'll pay for it. And it was an incredible course. The teachers were amazing. They're a group of gals from Florida. They were fun. They were so helpful. It was a blast. We had a great time. So this speaks to utilizing different vendors and seeing what's out there, seeing what's available. Okay. So another tool to help you get funding is using a communication tool to discuss your value, right? And so I've learned about an SBAR. It's actually required at my organization to have an SBAR, but in order to ask for funding. But I've used SBARs for other things too, and I'll talk about it in a minute. But an SBAR is a communication technique that stands for situation, background, assessment, and recommendation. And it was originally developed in the military to create a consistent process for clear communication. So I kind of described every part of the document. It's very straightforward and simple. It's can be effective for easy, quick, concise communication for a variety of things. I've used it with patients, just kind of to help tailor or organize my education. I've used it to share issues that we're having, like we had an issue with a department, and we were not having communication or having communication discrepancies. And so as a department, we created an SBAR so that we could clearly define what the problem was. Let's see, I recently, just actually today, sent in 2 SBARs to our inpatient rehab unit because I think that we need EMSTs available for all patients. So I asked for permission, and I wrote an SBAR last night and submitted it this morning. So it can be used for a number of things. When I created an SBAR for funding, in my situation paragraph, I really focused on how this TIMS MVP software is necessary to increase the accuracy in diagnosis and more effective treatment planning. So you can really put anything in any of these categories as long as it obviously applies. But this is just what I did that was beneficial for me. So I emphasized the return on investment. I highlighted how the investment will result in improved patient outcomes. I focused on the current gaps in care, which I did highlight because I think that's the most important part in a situation is what do we not have, and why does this matter? So I spoke to like different potential cost reductions in long-term care, right? Like fewer hospitalizations, less complications, those types of things that I spoke to in the ROI section. I'm really emphasizing to my funding folks, and I'll tell you in a minute who that was, but I'm emphasizing that everyone in the community is from patient to organization, is going to benefit from this purchase, and enhance our service delivery from an organization, but also as a department, and that it directly aligns with my institution's goals. I also mentioned in this part that, I also mentioned this part that 2 clinicians recently got trained. And so that helped speak to why I anticipate increase in referrals, and that we've already kind of have the ball rolling. And this is just the last piece of the puzzle, was kind of the intention there. So in the background section, I spoke to the industry standards and national healthcare guidelines, ASHA, lots of the research I embedded into this paragraph that helped strengthen my case for the use of the equipment. Let's see, I also positioned the request within the context of best practices. So these are just different ideas that you could use when speaking to, creating an SBAR and speaking to why you need what you need. Emphasize how the technology and training can improve patient satisfaction and staff efficiency, things like that. Oops. And then really in the background, TIMS has an amazing, and that's actually my next slide, but TIMS has an amazing resource where they kind of have a lot of this already done for you. They have a few documents that are like done for you documents. And so I wouldn't say that I like this all came to me by myself. I definitely used the resources that I had available to me. So yeah, here's the advocacy documents that I referred to or utilized. And then obviously they have one for an MBS program too. So check that out. They also have a whole website of different podcasts and research articles that will help you support your case too. So, okay. So I also had to create an SBAR for why my organization should pay for the staff to work on this project. So there's a technical component to incorporating TIMS MVP in your organization, not only from like the IT standpoint, but also getting your TIMS to speak to your PACS, to speak to your EMR system. And I didn't really realize the intricacies of that, prior to the purchase, but it is there's a lot of loops to, hoops to jump through. So they asked me to create an SBAR to basically demonstrate why my organization should pay for all these different departments to work on this project. So here I of course talk to the patient outcomes and things like that, but I really focused on like the technical problems. So in my situation, I talked about how the videos currently aren't viewable on PACS. We had like an order issue, and so our fees order was entered in as a consult versus a procedure, and so they wouldn't talk to Tim, so we had to fix that. The PACS link wasn't transferable to Epic. These are all different projects that different folks had to work on. And then being able to kind of drop the work list to back and forth was something that we had to improve. When it came to the background, I spoke to how the the specifications of the technology. I just got that straight from TIMS, one of their resources, talking about DICOM, which before being exposed to TIMS, I didn't know what DICOM meant. So there's a lot of learning that went on there, but the software and the suite of diagnostic tools that TIMS has is something that I think is important for you to include in why this technology is so beneficial to your department. In my assessment, I spoke to other departments that utilize PACS as examples of why we should also have it, and that there are similar procedures or similar results, I'll say, and then that by not having TIMS MVP and not having the ability to drop our images or videos into Epic can result in a duplication of studies. And if we fix this problem, then we can, save healthcare dollars. We can streamline diagnostic tools. We can improve efficiency from an organizational standpoint, and reduce the risk of HIPAA violation by eliminating the use of removable media. So all these terms that you've probably heard many people talk about, it's just a way to organize it so that different stakeholders know what you mean, and so that's helpful. And then my recommendations were very simple, and I think I skipped over it in the last one, but my recommendation for funding is that we need to purchase this TIMS MVP, and I provided the quote. And then my recommendation for the software evaluation is we need to allow fees to be viewable on PACS. We need to integrate the EMR and TIMS, and we need to integrate the PACS and EMR. So it was pretty straightforward solutions. It wasn't like, oh, I think that we would benefit from this, or I would ask you to consider this and that. It should be very clear and concise what you want from the person that you're asking or speaking to, your audience. Okay. When you are thinking about funding and when you're seeking funding, these are some different options that I researched. For me personally, I am extremely fortunate that my organization has a foundation through grateful patients and donors that provide financial assistance to our mission of healing. And so that's how I was able to obtain this technology, but I know not everyone has that. And so there are other options, like you could look for areas in your department's existing budget and seeing if there's opportunities to reallocate. Obviously, those conversations can be difficult, but it certainly could be an option. You can look for grants or external funding. So investigate if there's any available grants from government or nonprofit organizations that can help fund different healthcare innovation or improvement projects. The NIH and the HRSA, the Health Resources and Services Administration, do offer grants for clinical technologies or research projects. So if that's something that your organization can speak to, that might be a good opportunity. And then government and healthcare initiatives, exploring funding through different government programs that aim at improving healthcare technology, service delivery, things like that. So those are options that are available out there. Other ways that you can help support your case for why you need this funding is tracking outcomes. So this was something that I kind of just out of curiosity looked at and asked I actually tried to play around with the data to figure out how I could figure this out on my own, but then I ended up asking someone to write a code for me or a report for me, and it took him like 10 minutes. So ask, save yourself time and ask and see if there's things out there. But this to me is an interesting point, and can kind of speak to a little bit of my story. So in 2022, I just kind of looked and saw, I knew I felt like we weren't using the fees technology as much as we could be. And so I wanted to kind of demonstrate that. 2022, we did 8 total fees procedures. 2023, we did 15 total. And I will mind you, like, I don't, whoever's on the call, we are at a 240 bed hospital. So it's a smaller hospital. And there are 9 speech pathologists in my department, 2 PRN, 2 part-time, and then 5 full-time. And we also cover acute care level, ICU, inpatient rehab, outpatient clinic, adults, outpatient clinic, peds, the cancer clinic, and then all outpatient video fluoroscopy swallow studies. So we cover a lot of ground is my point there. But so 2023, we did 15 total fees. The first 6 months versus the second 6 months is relevant because it was in July that I took over this position. So I kind of wanted to show like, hey, since this changed, here's the difference there. And then this is a little bit of my timeline of some of the things that I've spoken to so far. But in January, we learned about the fees training course. In March, we did the training course. You can kind of see at this time our numbers really increased. April, we requested the TIMS MVP. We got funding in April. In June, we installed it and we've kind of maintained our numbers. We've had some staff out towards the end of this year. So I know that it's dropped a little bit, but we will continue to use our TIMS MVP and our fees system. I know I've done 2 today and I have like 2 this week. So those numbers are already growing. But this is just goes to show an example of how our addition to TIMS MVP and even more fees providers has resulted in, and this is a total of 89 fees procedures to date. So I think that that's kind of a nice illustration and something that you could consider if you need to use some data to help prove your point. This comment down here was someone asked like if we're just replacing the procedures or the instrumental swallow studies, and in my opinion, I don't think that we are. So then, but I wanted the data to prove that. And I was curious, like, oh, maybe we are. But 2022, this is about what we were doing for each procedure, 451 total versus 8 in that year. We grew to 511 to 15, which is relatively, not that much. And then 2024. So on a different scale, we are doing about the same volume in video fluoroscopy, but continuing to increase our fees procedures. So this is just a nice way for you to have some numbers and some data to help illustrate your point if you find it to be beneficial for your department. Okay. This is a side benefit that I kind of spontaneously, I guess, or maybe organically would be a better word, but at my facility, I was doing a different presentation. I'm working on developing a head and neck cancer pathway for comprehensive care. And so I was speaking to some of the gaps that we had in our current practice patterns, including the duplication of endoscopy swallow studies. Oftentimes the rad-onc will do their scope, but since it's not included on the EMR, I don't have access to the video or to the images. And so I spoke to how we're in these imaging silos, and that one solution that I was working on within my department to help with this problem is obtaining TIMS MVP. And so at that time, the director of the cancer center, he stopped my presentation. He wanted to know what technology I was talking about, how, give me some information about that. He actually had his assistant send me an email a couple of days later and wanted to know some more information about the TIMS MVP. So I could have spoken to a lot of different topics, in that presentation, but I really focused on cross-department collaboration, improving the staff and operational efficiency, and the audience of that table, cared about that. They wanted to know more. And so this is just a way of how you, if applicable in your organization or your facility, how the technology can be scaled over time and that it can benefit additional departments or service lines. Once your initial investment is made, you can speak to how it can be leveraged for more comprehensive clinical use and multiple patient populations. So for example, if you have like a stroke accreditation that you're working on, or you have an inpatient rehab unit that you're trying to incorporate a fees program at, you can speak to how this is going to benefit multiple settings and multiple patient populations. So there's just some more terms, sustainability and scalability that are for your use. Okay, so the last objective tonight is to apply some practical advocacy techniques to promote the adoption and optimal use of TIMS MVP for fees and in multidisciplinary teams. So I could honestly say that I've done most of these, a lot of these, but I'm again going to speak to these 6 for the purposes of time. Okay, so building relationships with key stakeholders. I think that this is important to identify who and to do so early. So by meeting regularly with administrators, DOR executives, whomever that might be in your facility, just keeping them informed about your department's needs and changes and challenges and why it's important to keep up with current practice patterns. This can be used to help demonstrate like how your resources maybe need to be reallocated. That it was beneficial for me. It didn't happen overnight. This was, every week as I was onboarding, I was meeting with my my director, and he needed to know like what was going on, and I needed to be able to describe these changes that I wanted to make. And so there was just multiple conversations happening over time. I didn't just come into this position and he allowed me to do all these things. I had to prove the why. Finding allies. So obviously your direct supervisor should be your first point of contact, but if there are any other key decision makers that might have influence over your resource allocation, building relationships with them. This will allow you to share your vision for the department's growth and how additional resources can directly benefit the organization. Me personally, since taking this role, I was given the opportunity to join some additional organizations and volunteer opportunities, and it has allowed me to meet more people in the organization that I might not have on a day-to-day basis. And they now know me and know my goals, know my professionalism, know how passionate I am about speech pathology. And so it just kind of helps you, if they're on your team, that they can speak to your integrity and your character. So I do think that that's extremely important. Another way to help you advocate for your need, whatever that might be, is like we've been saying all evening, patient-centered focus. So whenever you frame the request in terms of improving patient outcomes and quality of care, it will always be an effective way for you to talk about how the community and your patients are going to benefit and why this is important. One thing that I learned in a school internship that I did was during like heated or emotional conversations, like can be beneficial to remind everyone at the table that we're all talking about like this child here in the middle of the table. Sometimes I use that visualization. I certainly haven't said it out loud, but I can use that visualization in the conversations that I'm having with administrators to be able to speak to direct patients that we're serving at our hospital and how they are going to directly benefit, and give very clear examples of why these patients are going to benefit and how. I wouldn't say it's like an easy argument, but it's certainly a reasonable argument when you're discussing how your patient with head and neck cancer and their quality of life is going to benefit from this technology or this software or this training when we're being more effective with our dysphagia diagnosis and treatment. In my opinion, that's a no-brainer. And so I think it's easy for all of us to make that case. And maybe it's not easy, but it's reasonable to make that case in whatever situation you may be. Each healthcare system is different, so this may or may not apply to you, but if you can emphasize how your department is going to positively affect not only patient care, but also like your community and your reputation, your satisfaction, and even reimbursement, that might be, an area that you can tap into if it applies to you. Okay, so creating a compelling case for the technology, as you've probably figured out, all of these concepts are intertwined, right? So when I personally talk and present on dysphagia, I really try to capture at least one person's interest at that time, even if it's like not a formal presentation, but anyone that I speak to. And so I really think that if you can talk to the more accurate diagnosis, the improvement in clinical outcomes, how we can better manage our patients, all this data, even if you have like specific data, like I showed you with the graphs, or even case studies, maybe it's one particular patient that you find really captivating or compelling or interesting, can help you make your case, right? The other way to do that is to highlight the value of the technology. So this is a direct quote from one of the SBARs that I created, where I speak to how the measurement tools can help me assess swallow function in real time. And so by doing this, I used a familiar swallow study. So I would say at my organization, and as you saw with the numbers, we typically perform more volume of modifieds, right? So physicians, even PT/OT colleagues, like anyone in my organization, they're probably going to know what this image means. They've seen this before. Now that I have TIMS review, which is also like a serendipitous moment, but we found out that that was in our contract and it wasn't installed on any of our computers. And so I asked for it to be installed, and there it was, and it was already, paid for. So that was kind of a bonus. But when I did that, I started using the technology in a way that, in my notes, in a way that I could speak to why this TIMS MVP is important. And so I was able to use these types of images in some different presentations to speak to the why and how it can benefit our documentation and make it more robust. So at this time, when I received the TIMS review, I trained staff I asked staff to watch the tutorials on TIMS, which are really helpful. And then we played around with it as a team. And then the more people that started using the images in the documents, the more compelling and intriguing this became for providers to read our notes. So even something as simple as like an arrow to point out something or to point to the residuals, it can be extremely beneficial for identifying and supporting our narrative documentation. So this is one of my very favorite examples. This, I don't know if you can see this, but my arrow, but this is an example of the amount of residuals. So 46.5% of residuals in the oral cavity and pharyngeal cavity. I'm even able to like separate it out following an initial swallow. When I asked the patient to double swallow this exact same bolus, there was about 30% of residuals still remaining. I asked him to do a third swallow, and there was still, 23%, 24% of residuals remaining. So then I started implementing some strategies. I used a half teaspoon, which resulted in relatively 29% of residuals remaining in the molecular space after the swallow. And then I taught him using an MDTP swallow technique, and it resulted in 9% of residuals on the base of tongue and 7% of residuals on a second trial. So these are two separate boluses that help kind of just demonstrate why speech therapy intervention is important, why he needs further intervention, and also just is a compelling case for what the technology can provide in our documentation. Okay, so last but not least, I know we're getting close on time, but um, budget and cost analysis. So this is a way that you can, so I didn't personally develop a budget when I asked for these things or even a proposal, but it's certainly something that I've done since then. So I'll kind of show you in this next example, but um, you can create a detailed proposal if you document it well. Maybe your DOR wants that type of document, and so you can work on that. Advocating for why you need the resources, whether it be staffing or equipment or training, and breaking down each of the needs and the sources, potential sources. And then you could also create a cost benefit analysis. So these are just two different tools of how you can show how your department's growth through additional resources can lead to cost savings in the long term, readmission rates, efficiency, or even increasing referrals. Like I said, I've used this cost benefit analysis for a different project that I'm working on. And so I wrote an SBAR. I asked for funds to help grow our staff in order to provide more comprehensive care in our head and neck, our Hall radiation cancer clinic for head and neck cancer patients. And so I asked for different things, and then I gave what we are currently running at, and then what the increase, if invested, what the percentage increase would be in our department. So it's a very simple example of how you could show that. I think this is the last point, but I think it's really important to, and something that I have gotten a lot of positive feedback since being in this role is making it part of the clinical workflow to have positive culture. So whether it be positive support and growth mindset, mistakes are welcomed. These are challenges that we see as opportunities. We're all learning, we're all improving, we're all at different stages in our career. And I truly believe that my team members feel safe to make adjustments, to try new things, to ask questions. And naturally, we've grown a ton in the last year and a half. This is routine practice. It's not like we do it sometimes. It is something that is part of our culture. And then I'm a big believer in that as a leader, it's my responsibility to model best practice and be a champion of the system. So for TIMS MVP, I work really hard to incorporate it in all my documentation as a way and as an example for others to follow. It sets the tone, it raises the bar, we are a team, we're doing it all together. It's not I'm telling you to do this thing and then I'm not going to do it myself. This is truly a great way to foster continuous improvement and innovation in your department. Advocacy. So to wrap things up, this is advocating for your professional development, advocating for your staff's professional development in order for you to elevate the entire department, which can help in not only improved skills and delivery services, but also job satisfaction, retention, and recruitment for your department. Following up and being persistent when you're advocating for things. So keeping regular updates for your decision makers, keeping them informed with what you're doing. I definitely send emails to the folks that I'm working with on different projects to keep them updated. Some projects I host monthly meetings so that we can continue to just discuss and update and talk about things. After an initial request, I always send a thank you follow-up for their time or their consideration. So by demonstrating that you have a sustained commitment to the department needs can help with the momentum and your character. And then being persistent but professional. So this can be a long-term effort. I'll definitely say that I'm just getting started. This is a year of a lot of growth, but I still have a lot more goals, and my department has a lot more goals that we want to work towards. So be patient, be persistent, and reiterate the importance of the department. Even if you get a no or you get some pushback, continuing to advocate and being persistent, I think will be beneficial. So in conclusion, by adopting TIMS MVP in a multidisciplinary clinical setting, it can make you more well-rounded as an organization. You can create a strong case for the technology. You can identify and engage stakeholders early, address concerns, provide comprehensive training, track outcomes, and then overall your facility is going to ensure successful implementation and optimal use of the system if following a similar course or using some of these strategies. The research shows, and I can speak from personal experience, that with this kind of serendipitous year, I'll say, and through hard work and support and leadership and data, our use of this software has significantly improved our patient care, our quality of services, and the efficiency in our department. Some last recommendations that just as I was preparing for this presentation, say what you mean and mean what you say. So when you're getting in front of colleagues, admin, executive teams, and you're talking about what you're passionate about, I would just encourage you to, if you say you're going to do something, do it, because it'll continue to have trust in you and what your skills are and what you want to do from a project development standpoint. Make good trouble is my quote, my favorite quote. And when the patients are at the center of the table, the risk is worth it. So I'm very persistent, and I like to ask questions, and I like to think of different ideas, even if I'm told no, like what other avenues we can explore. Shared decision making too is probably one of the biggest lessons that I've learned in the last year, that by working together as a team and a unified front, that a lot of fun stuff and magic can happen. So highly encourage you to create goals as a team. So next steps from my standpoint is I want to incorporate some patient testimonials. So I've developed a survey and I'm sending it to patients in different settings so that I have some examples to speak to when I'm working on future projects, and also can obviously identify any areas that we can improve on. I'm working on consistency within the department. So competencies, consistent evaluation measures, flow sheets, workflows. I'm doing a lot of flow sheet revamping right now. And then one thing I want to do in 2025 is track some key performance indicators. So I'm not sure exactly which one I want to do yet, but I want to work on creating some reports that show, since we've done this, we've had a decrease in aspiration pneumonia rates, or reduction in the patients that we have on our caseload, their hospital stay, or any cost saving data that I can obtain. So I'm not sure, but if anyone has any ideas or has done this, I'd love to hear what you did and how you did it. So this is a quote that I recently heard from another amazing SLP. Don't let what you cannot do interfere with what you can do. Definitely one of the lessons that I've learned over the last year. So thank you so much for listening and joining me this evening. I will open it up for some questions. Shannon, what do we got?
Yes, thanks so much, Claire. That was great. So we have just a couple questions. The first question was scope cleaning and efficiency. If you have more than one patient that needs to be seen in one day, how do you handle this?
Yeah, great question. So this goes back to my point of finding some key allies. So I don't remember where I was or what I was doing, but we previously had respiratory therapy cleaning our scopes, because they clean pulmonology's scopes, and so I don't remember how it got brought up, but I somehow ran into the manager of Central Sterile and kind of just was telling her about our current process and was asking her questions about how they do things. And she's like, well, why don't we have coffee together and figure out if there's something that I can do to help? Like, she's been at the organization for a long time. And we ended up having coffee. She is a wonderful role model from a leadership standpoint. And we ended up working together. And so now Central Sterile cleans my scopes. We used to get scopes back in a longer than I will admit time from the previous process, we now get scopes back within like an hour to 2 hours at tops, but usually it's about an hour. So I would speak to your infection control administrator and your central sterilization department that you have, and see if there's options for what you can do. Obviously, disposable scopes are another option, but I know for me and my facility that was not a feasible option. But we do have 2 scopes that we use, and one is definitely favored than the other. The other one's much older. It still works, but the one is more preferred.
Perfect. And last, we just have a comment and a question. So they said, fantastic information. And are the slides going to be available? And yes, we are going to post the slides with the replay. So those will be posted on the TIMS website. And with that, that is all of the questions this evening. So just a quick reminder to fill out the survey for ASHA CEU credit. And if you would like a certificate of completion, please email tims-univ@tims.com. And with that, we will finish this. So thanks so much, Claire. This was an awesome presentation, and I hope everyone has a great night.
Thanks for having me.
Thank you.